Glad to be here. I'm Ray Johnson. I'm currently have all those titles for Saga Bio Incorporated. That's temporary. We're a translational immunology and immunodiagnostics company. Our first project is Kawasaki disease. That's a febrile vasculitis in children that affects coronary arteries. Typically, the children are between 6 months and 6 years of age. The diagnosis is based on a fever of 5 days plus 4 or 5 possible physical findings. To medical eyeballs, Kawasaki disease looks like a viral illness, and it's easily missed by pediatricians and family practice physicians. Angiographic studies suggest that 2/3 of cases in the United States go undiagnosed. The treatment for Kawasaki disease is to hospitalize the child and deliver pooled human gamma globulin. That's essentially antibodies. So there's a need for a rapid diagnostic test for Kawasaki disease to guide what is ultimately an expensive therapeutic decision. So here's our science. Do I have a pointer? I don't know, do I have a pointer? But anyway, you can see in yellow there that while Kawasaki disease looks like a virus to medical eyeballs, at the cytokine level, it looks like a severe bacterial infection with, I have to look backwards now. It looks like a severe bacterial infection with very high levels of soluble TNF receptor 2, which is a readout for TNF alpha biology. And not surprisingly, Kawasaki kids also have elevations in vascular chemokines because you have blood vessel inflammation. So this is the algorithm from our published paper. Basically, this works because viral infections are about interferon, bacterial infections and Kawasaki disease are about TNF alpha, and Kawasaki disease includes blood vessel inflammation. So if you're a febrile child, your soluble TNF receptor 2 level is low, you probably have a viral infection and you can go home. If it's markedly elevated, that means you're very sick. If it's markedly elevated and your vascular chemokines are also elevated, you have Kawasaki disease. So it's all biomechanism based. So this, we're developing a soluble TNF-R2 point-of-care test. That's more than a Kawasaki disease screening test. It turns out soluble TNF-R2 is a really good biomarker for serious inflammatory events that probably require hospitalization. You can use that to simplify febrile child evaluations in emergency rooms. It also identifies children who might have Kawasaki disease for additional evaluation. The market's quite large. Fever is the #1 complaint in pediatric emergency rooms and 30% of outpatient pediatric visits. We're going to revisit that figure down in the corner in a coming slide. So the technology barrier was no antibody pairs for capturing and detecting soluble TNF-R2, so we've made those monoclonals. We currently have a CLIA certifiable soluble TNF-R2 ELISA that performs better than R&D system kits, and we have a soluble TNF-R2 lateral flow point of care prototype device, which is shown there, and its performance characteristics are just to the right. So our relevant competitor is procalcitonin. Procalcitonin is a really lousy screening test for Kawasaki disease because in children with Kawasaki disease, the level of procalcitonin is not statistically different than children who have viral disease. So that's what you're trying to distinguish. Whereas if you look at soluble TNF receptor 2, it's very high in Kawasaki disease, KD. It's still high in serious bacterial infections. It's still elevated in severe viral infections that require hospitalization. And then it's low in healthy children. That's kind of the pattern you want. It also matches up your risk. So our revenue stream, the soluble TNF receptor 2 ELISA is pretty much ready to go, as is. The next would be the soluble TNF-R2 point of care test. We have a pipeline. We have therapeutic anti-inflammatory monoclonal antibodies that have already been humanized and are in preclinical development. We have the intellectual property to support all this. Our lead academic investigator is Kelly Bergman. He's a director of emergency medicine research at Children's Minnesota Hospitals in in Minneapolis. Our lateral flow device development partners, Nanocomposics. Our funding is going to come through a phase 2 STTR. And as of today, we are a physical company as we've rented space at Biolabs New Haven.